The problem with Barack Obama's health plan is that it's focused on the wrong thing. It focuses on expanding health insurance coverage rather than on making health insurance and medical care better, cheaper, and safer. And the only way to do that is to give consumers control over their healthcare dollars and their healthcare decisions. Americans are frustrated now by the same things they were frustrated by in 1993. The cost of health insurance is rising dramatically. It's eating up an increasing share of wages. And a lot of people can't afford health insurance. And we've got a lot of quality problems in the U.S. healthcare sector.
We cannot continue these spending patterns in public or private dollars for health care for less and less and less every year. We can do better.
The Obama health plan is every bit as ambitious as the original Clinton health plan, and it may be more so. The Obama plan would require a lot of people to buy health insurance through an employer. It would require parents to buy health insurance for their children, and it would create a new government program. That's something the Clinton plan did not include. This new government program would be modeled on the Medicare program, but for people under age 65. And that would essentially double the Medicare rolls within just a few years.
Given the current economic situation, would either of you now favor controlling health care costs over expanding health care coverage?
Here's what my plan does. If you have health insurance, then you don't have to do anything. If you've got health insurance through your employer, you can keep your health insurance, keep your choice of doctor, keep your plan.
That's just not true. About 30 million Americans would end up switching health insurance under Barack Obama's plan. Some of them would have to switch because their employer would decide for them. They would either switch to another health plan in order to comply with Obama's mandate, or they would drop coverage. And then those workers would have to go out and find coverage on their own, maybe in a government program. And every one of those workers who has to change health insurance, well, that can threaten their relationship with the doctor they have right now. The Obama plan is actually a very large step towards socialized medicine. Now, you have to understand that America's healthcare sector is about half socialized already. Government controls about half of the medical spending as it is, and indirectly controls a lot of the rest of the medical spending. But what Barack Obama would do is he would expand government programs. He would create a new government program that would essentially double the size of the current Medicare program. And he would exert a lot more control over all sorts of other decisions that Americans make about their health insurance and their health care. So socialized medicine exists when the government controls the medical resources and socializes the costs. And that's what government does through programs like Medicare, Medicaid, the State Children's Health Insurance Program, and the new Medicare program that Barack Obama wants to create.